I have a confession to make too, Ernesto. I was running around out there during the tea break, and I fell down and I scraped my knee. I've got a pretty bad boo-boo under this. I'm not going to cry because that would be embarrassing for both of us, but I'm just wondering if you have a Band-Aid.
I don't.
Okay.
I'm sorry.
Well, what about this, though? You kind of left us hanging. Did you fix that Band-Aid? Was that the first thing you did when you got to New Brunswick?
We did fix it. It was not the first thing. On one of my trips, as you're onboarding a giant corporation, they put you on a plane and you travel the whole world to understand the company. I took a trip down to Florida to visit our contact lens facility, but it also does Band-Aid manufacturing. And I got to see these machines that are on a roll spitting 1,000 Band-Aids per hour.
Wow.
And I'm looking at this machine. It's like one of those old film projectors with these big reels of material and stuff, and realized that the wrapper, all they need to do was to flip it. So go back to the supplier that was helping us, flip the printed side so it was on the other side, put it back on the machine, done. Didn't cost anything. And it's rolling out now globally. So simple thing, right? But the ironic thing with the battery, the Band-Aid is they were designed for flesh-colored Band-Aids, not artwork. And they never thought to evaluate the whole solution. So they just put it in the same wrapper. Mm-hmm. And then that's how we ended up that. But yes, we fixed it. We addressed it. We addressed it in time for Star Wars Band-Aids. So
that's big. I have some of those at home, actually.
Do you?
Yeah. I like Chewbacca. So I was curious what the first thing you would do is when you come into such a massive company, new position, first person in this position at J&J to be a chief design officer of the whole enterprise. There was a designer of consumer products. But I guess you just sort of told me the answer. They flew you around the world to see the breadth of things. But then where do you start? You know, you come in and you could tackle Band-Aids or you could tackle whatever else. Like, how do you make a start?
Well, the first thing we had to do is kind of teach the existing design team to unlearn some of the things that they had developed. They were very focused on only packaging, bottle packaging, labels and graphics, and not necessarily other categories outside of that. So it was very consumer focused and very packaging focused. So there was that unlearning. And then this notion of ecosystem thinking, they were like, well, what do you mean? Why would we consider all those things? And so it took a combination of teaching them and introducing them to new ideas and hiring people from the outside. We've hired a lot of people from agencies who've done this type of work for them to start mixing with the internal employees. So that was just for the design studio. And then it was a lot of engagement outside, and I made a pitch deck, which is funny. Barry talked a little bit about iPod. I worked directly and indirectly with Apple from 2002 to 2014 when I left, and was at the front end of that whole ecosystem developing iPod accessories for them and in-car integration and how it integrated in the retail store, and learned a lot about that. And so I used that to show the presidents of our beauty category, the president of our oral care category, and they started like, okay, you're right. It shouldn't just be goop in a bottle, right? There's so much more. And with digital, it just made a lot of sense. So I had to kind of win them over first. And now we're doing pilot projects. And Mauro made a great point today that, you know, you're in the same room, you all kind of agree, you go away. It's the demonstration. You have to go back and show them something and start having little mini successes. Mm-hmm. And then they start to become your advocate. And they're now telling the other president, you need to go work with this design team because this is really helping us. So that's a long answer, sorry, but that's how.
So I wanted to ask you, you mentioned your experience working for so many years with the Apple ecosystem, dealing with technology, but this is a different kind of technology at J&J, a very science-based company, as you said in the presentation. So how big of adjustment was it for you to come into a company that's so science-based, that has some really, really advanced surgical devices and that kind of thing? You know, do you set up a meeting with somebody who runs, you know, a medical device team, and you go in and say, like, I want to bring design to what you're doing, and, you know, do you just get like a blank stare at first? I mean, how do you get over that hurdle of saying we're gonna design what you do, your science?
So first, I have to give a lot of credit to our medical device design team in Cincinnati. They work very closely with engineering. They don't do as much ecosystem work. They're very focused on the surgical tools and the implants, but they already were kind of there and had made a lot of progress just in the awareness that design is a valuable partner. I also had the benefit earlier in my career to work for an agency that did a lot of healthcare design. So I worked on angioplasty lasers, patient care monitors, orthopedic surgical gear, and I brought that credibility in as well. But because of the shift that's happening with digital and mobile solutions, the experience at my former company had a lot of weight and credibility with people in conversation because they realized being so science-based, how are we going to prepare for a world where everyone reaches into their pocket and takes out their smartphone and accesses that information? So it was just a combination of individual by individual almost, or team by team, a lot of leadership. So when I flew around, they would make me present to a room of 30 people consistently about what design was. Must have did that 15 times in the first 6 months. Mm-hmm. Yeah.
So I want to remind everybody in the crowd that we're going to be taking questions. I see we're getting some questions popping up on the iPad, but also if you couldn't find the app, you can raise your hand and we'll try to get a mic to you. I have to take this question because it's from future J&J designer. I don't know if you made a job offer this morning.
We are looking.
Yeah.
So
the question is, what is the most important quality other than being a T-shaped designer that you consider when hiring somebody for your team? What do you look for when you're hiring?
So we're looking for people that are very curious. I think that was discussed today, and optimistic also. The combination of those two things means that you believe that you can take on any problem to solve. If you don't have those two qualities, then you're going to be the person that's kind of cynical or doesn't feel like doing their work to go explore new ideas. So those two components are key. Collaboration. If they don't partner well, it's not going to happen because when you're talking to these science-based people, they have to see you as a partner. You have to listen. You have to listen to. I mean, there's a lot of qualities, but I think those are probably the 4 key ones. Mm-hmm.
I mean, you mentioned, as Mauro was talking about technology and how quickly the business environment is changing, and J&J is about as global as a company gets. How do you integrate that on a day-to-day basis? How do you design that into your products and your customer experience so that you stay ahead of the curve rather than you're reacting to changes?
So we've established a health tech summit that took place every quarter for the last year and a half. And we bring in the experts from across our company. They could be in orthopedic surgery or 3D printing. And we're doing a lot of sharing. And my boss, Sandy Peterson, is also trying to make sure that we don't have too many independent, duplicative efforts, because then you're not really leveraging your resources. And so by having this summit, everyone gets connected. And then they share their ideas, and then they realize, oh, I'm working on the same thing. Oh, let me share with what we've got. So that's been hugely helpful. But we're also hiring a lot of people from the West Coast. We've hired people from Google, tech companies like Facebook. That's helping shape the culture right now. And so it's kind of this science-based company with this kind of influx of design and tech, digital tech coming.
So here's an interesting question that just popped up from Tanya. Big multinational companies like J&J have traditionally repackaged goods from Western markets and sold them in Asia, she says. Not a lot of innovation there. How are you leveraging design to bring new products to Asian markets or to design products maybe that appeal better to Asian markets or serve people in Asian markets better?
That's a great question. It's a real question. I don't think we do the quality job that we need to do yet. That's why I'm here. Seriously, that's why J&J is here. We have an office here in Singapore with a lot of people, and we know that design with ethnographic research and co-creation with people that live in a region will come with solutions that match their needs. I mean, there's cultural things that are different. Feminine care especially is very different in North America than it is in India or Malaysia, right? So that is happening. We also need to become less of a North American company, just honestly. And we're very committed to that. Our designers are on the plane all the time. We have a woman designer in Malaysia right now looking at mental health therapy. So it's being worked on. And because of the long lead times, it will take a little while, but you will see tailored regional products.
How do you do that research? Take insight, how do you get the right insight that you need to take it back, start prototyping, start a design process for a new product or a better designed product for a new market?
Well, usually a team drops into the region. Let's say it's Malaysia, like this trip that's happening right now. It's going to be combined of a designer, a marketing person, an engineer, maybe some R&D folks that are focused on this problem to solve. And they're going to listen, they're going to learn, they're going to take photographs. I mean, this is kind of common design process, but not everyone does it still. And sometimes within a day or two, they'll develop ideas in the field and get back with them and start to play with these ideas across the table and get their feedback. And right away, Mauro made a great point, that everyone's talking about the thing on the table, not this idea that everyone's imagining looking 5 different ways or experiencing it 5 different ways. And so that's how we're doing it. And at the end of the day, a lot of the manufacturing process are pretty much the same. It's how you configure it or how you layer something. Or maybe it just needs a slightly different formulation for people like ginger flavored or something out here if it's Listerine, right? So co-creation is the key.
Here's an interesting question from the main room, but the question is, do you report to like the head of marketing or do you report directly to the CEO? And what I'm curious about is, do you have like walk-in privileges with your boss, and how do you make sure that design is involved at the beginning of processes, or at the top down decision-making process, so that it's new products or new marketing programs can be designed, with your input?
Good question. And design is positioned very high in the company. It does not report to the CEO directly, but there's one layer below, which is the executive and management committee. I reported to Sandy Peterson, who has responsibility. She has the largest chunk of responsibility in the company. She has IT. She has supply chain. She has consumer. And she also has diabetes, vision care, and medical device. So she manages over 75% of the employee population. She has been the one out there being an advocate champion for design. And even with some of the most recent news in my end-of-year review, she said, Ernesto, don't worry. You'll still report into me. Design needs to report in here. And so she's just a huge advocate. And she keeps making the introductions. Her whole role is to help eliminate roadblocks for design. And she's great.
Okay, I just want to see if I'm still getting a lot of questions here, which is great, but I just want to make sure people, if anybody has a question, wants a mic, they get a chance. So if you have them, get ready. But here's an interesting one from Jay. Tell us about a memorable experience when you blended sort of a science-based product or approach with maybe sort of design, more creative design, and come up with a solution. I think on a, not designing a new Listerine bottle, but maybe designing a more challenging, medical device, or even like how to take a medicine,
Okay, so I'm going to have to be a little bit cryptic in my answer.
This is good. This is top secret stuff.
Yeah, we're threading the surface there, right? So because we had to make this big shift of going from consumer packaged goods, which is still a huge part of our business, it's critical to the consumer brands, we started to move upstream in innovation. And we've been getting involved with programs where we do design thinking. We convince them of looking at programs differently, not to be incremental, not just to make it slightly better than what the existing product is today. So for example, and here's where the cryptic part starts to happen. Let's say we take a region like India. We watch their behaviors, and I can't even get too close on which care-centered category it is because it would be risky for me. But let's say
no one here is going to repeat anything.
Let's say it's a care-centered category. We observe what their rituals are, how they engage with clinics, healthcare, and we find things that are radically different that they do out in that region than they would back in North America. We take those insights, we take the connections of stakeholders of that ecosystem that's in that region, we map it out, and we start to find ways. We do some insights work where we realize their behaviors are actually different than ours. And so then we start to prototype it. We create videos. And we had a crew go into India and create a video to explain this whole new way of approaching this one care category. And my gosh, the business partners are so excited because this is the first chance they're feeling like they could do something that's just not another incremental step. And it's getting presented to senior leadership in the next few weeks. So we're doing a lot of programs like that.
This is an interesting question from Shin from H1 Studio. Do you use augmented reality or virtual reality as a design process tool? Is that something you've already integrated, or is that something you would think about integrating into your design process? Another way of looking, not sort of technology touching the consumer, but technology enhancing or advancing your design process.
So in the medical device arena, we definitely are. There's new ways of performing surgery. So I can't get too explicit there, but that is happening. We're also looking at VR for mental health therapy. That's neural imprinting, I think, is one of the terms that's out there. Are you familiar with that? I'll give you an example of what it is. Let's say you came back from a Middle East war and you lost your arm. And you get these phantom pains that happen, and there's nothing you can do about it. Your limb is not there. But there are therapies out there now where you put on VR goggles and you feel like you have an arm. And through reprocessing and retraining the brain, it feels like you have some control over the pain. I'm not doing the best articulation, but pain is one huge area for virtual reality, augmented reality kind of therapies.
With such a vast company and so many different processes you can dive into, I mean, you were showing us new workspaces within the company, new systems for how to distribute products, how to use products. Like when you come into work every day, how do you decide what you're doing now? How do you kind of step back from the weeds of all this and figure out what's right to prioritize?
Well, fortunately, I have a very strong design leadership team that we built over the last 2.5 years. And with those 3 solutions areas, one very strong leader focused on each one of those businesses. They themselves are very capable. What I'm trying to do is build a culture to groom future CDOs, because the world needs more CDOs. And so I'm empowering them, I'm trusting them. They go to leadership team meetings with our medical device teams or our pharma teams, and they're right there. I get called in, as Sandy does for me, to take roadblocks out of the way for them. Mm-hmm. So I try to spend my time kind of bottom up and top down, where I'm involved with strategy, but I like to get involved even with the details, like that Band-Aid wrapper example, because if you meet it on both sides, it kind of takes care of itself in the middle.
Here's a question from Pabathran. How is care-centered design, which you talked about, different from human-centered design?
So there's human-centered design, there's people-centered design. I mean, even design thinking, right? I think it was said last 15 years is kind of this. I call design thinking also integrative thinking, just the idea of getting different points of view, different stakeholders coming together. Design is one of them. But we call it care-centered design because the word care in itself displays empathy, and as we know it, our species has empathy and cares. So it's just another way of calling it people-centered design. I also think that human-centered sounds very mechanical and not very empathetic, so we just arrived in a way to differentiate it. I guess it's marketing. Yeah.
What is bad design? We're talking a lot about good design today. It just occurs to me, do you know it when you see it?
I know it when I experience it. I don't place so much judgment. I mean, aesthetics are amazing, right? I love beautiful things. But for the work that we do, getting the best outcomes for patients or the best consumer experience with your baby product, it's got to work. And it's got to be easy. It's got to be intuitive. That's good design. When it doesn't do those things, it's bad design. That Band-Aid wrapper, as simple as it is, that was bad design. And it was just like immediate. I didn't even think about it. It was just like, how could they miss that one? So,
I got to read this question too because it's from someone named Cynic.
Simon's here.
You were talking about optimism being a key aspect of what you do and what you look for in people. And Cynic wants to know, how do you keep optimistic while being pragmatic, preparing for worst case scenario? How do you try to strike a balance? I guess the question there is like, how do you sort of come in every day excited to solve a problem and not, be overconfident?
Is that cynic like cynical?
Like cynical.
Oh, I thought it was Simon Sinek, who wrote a book. It's a very famous book. I think you have to realize that you're not going to get everything you want or win every battle. But optimism is seeing progress over time and making partnerships. It's relationship-based. Johnson & Johnson is a relationship-based company, and you build trust. So the optimism of building a relationship, that's important. It shouldn't just be like, oh, will I get my way today? Or no, I mean, you're going to have bad days, but I look at optimism as knowing, I believe in the power of design. So when you believe in it, you're optimistic because eventually they're going to get it. So I think that's just the way you need to look at it.
Okay, Ernesto, well, our time is winding down, but I really want to thank you, and I hope everyone will join me and thank you for joining us here and telling us about your story.